So if you're watching this video, you have probably spent tens of hours researching OP, from cortisone injections to PRP shots to how long you should be resting or whether you need a hernia operation. And what I hope is that by the end of this video, you understand that all that information is white noise, and that this video acts like a little bit of an information reset, so you can focus on the things that you need to be researching and understanding in order to make sure you get better permanently. So let's get stuck into that. So my first question to all OP patients is this: why do you have OP? And their answer usually revolves something around, I had a kid 3 weeks ago, and then I started walking, and then I started to feel this dull ache, or, I was training for a marathon, and then I started to increase my training load, and I started to feel this dull ache, and I'll be like, no, stop. You're telling me how you got OP. Can you tell me why you have OP? Because lots of people run, and lots of people have kids, and they don't get this really rare condition. Why do you have OP? And this is where things usually diverge. So first people will just be like, I don't actually know. I don't know why I've got it. It's really annoying and really unfair. Or some people will say something along the lines of, my feet have always been really unstable. I've always had to wear orthotics, and I've always felt like that's put pressure on my hips, and it's always felt a bit uncomfortable, and I don't know why, but I really feel like that's connected somehow. Or my core, the left side of my core is just never activated effectively, or my left glute is just never fired effectively. And I don't know why, but that is somehow connected to why I feel this pain in my left side of my pubic bone, or even the right side of my pubic bone. And I will go, good job, you are now starting to ask the right kind of questions. From my experience of treating OP over the last 8 years and over 1,000 patients, 99% of the time, OP is caused by bad mechanics. And simply put, what I mean by that is the pelvis is designed to work in a very specific way, and you are using and you're moving your pelvis in a way that is not the way it's designed to be. Your pelvis is unstable. Those unstable, improper, bad movement patterns, the way you are functioning your pelvis, is putting pressure on the pelvis in a way it can't handle. It is overloading that pelvis. That overloading is causing damage. That damage is creating the pain that you experience as OP. Bad mechanics leads to damaged pelvis equals pain. As simple as that. And the only way to fix OP is to actually address those bad mechanics so that you stop overloading the pelvis and has an opportunity to heal. You might want to get a cortisone injection. You might want to tape your kinesiotape your pelvis. You might want to get a hernia operation. And I'm not going to say those things aren't appropriate. I don't know your case. But at the end of the day, you can do all those things, but if you go straight back to those bad mechanics, you will go straight back to overloading your pelvis, and you will go straight back to feeling pain. So when that cortisone injection wears off, you'll feel pain. You might do the hernia again if you have the hernia surgery, or do the hernia on the other side. It won't matter if you don't fix those mechanics. So I'm challenging you right now, either book in for an initial consult with me and I'll do a biomechanical assessment with you, or go watch the biomechanical assessment video and do the biomechanical assessment so that you can see exactly how unstable your pelvis is. Because you'll be able to compare your pelvic movements to my pelvic movements. And when you can see that your pelvis is really unstable, you will start to understand, oh, I am doing these things that are breaking my pelvis. And if I don't stop, I'm going to keep experiencing the same pain over and over again. And now you're asking the right questions. Now you're looking for the right solutions. And sure, it will be complicated. It will be hard to figure out what kind of core activation you should be doing and how the feet are connected and how to integrate all these things. And I would tell you to just book in and see me because I will help you through that. But even if you choose not to do that, at least you are on the right path. So block out the noise. Focus in on what matters. Why do you have OP? Answer that question and answer the question of what is it that you'll be doing that will make you better? Because once you have a clear hypothesis and a clear cause and effect on that, it might take you a year, it might take you 10 years, but you will get better. Whilst if you're just focusing on all the symptoms and how to fix those, you will never feel better. You will never permanently deal with this condition and you will be battling it forever. So I've been treating OP exclusively over Zoom and Skype for the last 8 years. Trust me when I say I know what you're going through, because I've been through it with over 1,000 other OP patients who are sitting in the exact same situation you're sitting in right now. Confused, annoyed, desperately just trying to figure out why you have this condition and what you need to do in order to get better. So I'd really recommend booking in for an initial consult with me. I charge a fraction of the cost that I would for a full consult. I'll assess you, I'll look at your movement patterns, I'll give you a good idea as to why you have this condition and some of the broad steps that you'd be taking with me if you're going to get better from it. And so even if you decide that I'm not the therapist that you want to go with, you'll be armed with the kind of information to make better decisions about the type of therapies and the type of therapists that you'd want to engage with in order to make sure you get better permanently.